Good afternoon, everyone. I am Dr. Barbara Malkas. I'm the superintendent of North Adams Public Schools, and I am also the very proud president of the board for Massachusetts Breast Cancer Coalition. I am honored to be the moderator for this event, and I would like to thank our very distinguished panelists and all of you out there who are joining us on this webinar for today, which is on PFAS in food packaging and related policy challenges. Dr. Laurel Schaider is a senior scientist at Silent Spring Institute, where she leads the Institute's water quality research on PFAS and other contaminants of emerging concern. She studies PFAS chemicals in drinking water, consumer products, and food and drinking water contamination from septic systems, as well as environmental justice disparities in drinking water quality. She is the lead investigator of PFAS Reach, which stands for Research, Education, and Action for Community Health, a study evaluating PFAS immunotoxicity in children and addressing the needs of communities affected by PFAS water contamination. She is part of the University of Rhode Island's STEEP Superfund research program and co-leads community engagement activities on Cape Cod, including a study of private wells that you'll hear about today. And she is the lead investigator of a new study announced last month, funded by the Centers for Disease Control and Protection on PFAS health effects in 2 communities in Eastern Massachusetts. Before joining Silent Spring, she was a research associate at the Harvard T.H. Chan School of Public Health. Dr. Schaider earned her master's and PhD in environmental engineering at the University of California in Berkeley and a bachelor's degree in environmental engineering science from MIT. Born and raised in the town of Millbury, Massachusetts, Senator Michael Moore has been representing the people of the 2nd Worcester District since his election to the state Senate in 2008. Senator Moore has dedicated his adult life to public service, serving as a law enforcement officer, environmental investigator, town selectman, and assistant deputy superintendent at the Worcester County Sheriff's Office. Senator Moore currently serves as the chair of the Senate Committee on Post-Audit and Oversight, the chair of the Special Senate Committee on Cybersecurity Readiness, and vice chair of the Joint Committee on Financial Services. In addition to these roles, the senator also serves on the U.S. Department of Justice Global Advisory Committee and on the National Conference of State Legislators Public and Private Partnership on Disaster Mitigation and Recovery. 2 important pieces of legislation authored by the senator that have been enacted into law are Nikki's Law, which provided protections for persons with disabilities, and legislation which seeks to address and bring an end to sexual assault on higher education campuses. Mark Ells has worked for the town of Barnstable for 31 years and is currently the town manager. He has also been an adjunct faculty member at Cape Cod Community College for 19 years in their business administration program. Mark serves on several regional and statewide committees ranging from environmental, human services, education, and transportation issues. Mark holds a bachelor's degree in engineering from Norwich University and an MBA and MPA from Western New England University. He has played an integral role in supporting the environmental research that has been conducted on Cape Cod. The town of Barnstable and town manager Mark Ells continues to be a strong advocate for environmental change. And our last panelist, Mia Caldwell, is a policy and outreach intern with MBCC, who I am told by Executive Director Cheryl Asimo is a dedicated advocate who, since the start of her internship in May, has helped to add 10 new co-sponsors to S1494. Her success in helping this endeavor is due to her perseverance with phone calls, emails, social media, and understanding that we must all come together to promote change for future generations. So as you can see, we have a very distinguished panel of guests here today, and we'll start off with you, Dr. Laurel Schaider. Can I ask you to provide our audience with information and updates on PFAS and where we are since the last time we met?
Sure. Thank you very much for that introduction, Dr. Malkas. Let me just share my screen here. Okay, can you see my slides? Great. So thank you very much for the opportunity to be a part of this discussion today. I'm going to kick things off here by providing an overview or a reminder about what PFAS chemicals are, why they're a concern, and talk about PFAS in food packaging. And I also wanted to share some updates and information about 3 federally funded studies that Silent Spring Institute is leading related to PFAS exposure and health effects. Silent Spring Institute is proud to be partnering with Massachusetts Breast Cancer Coalition as one of our local community partners for all of our current PFAS research. So my guess is that many of you are already familiar with PFAS, but for those of you who are new to these chemicals or could use a bit of a refresher, PFAS is an acronym that stands for a class of over 9,000 different compounds. They're characterized by having many carbon-fluorine bonds, which means that these chemicals are entirely or partially resistant to degradation. For this reason, they're often called forever chemicals. They're mobile in the environment. They've been found in wildlife as far away as Antarctica and in the Arctic, and they're also found in all of us. Testing by the Centers for Disease Control and Prevention have found PFAS in over 99% of Americans that they've tested. This widespread exposure is concerning because exposures to certain PFAS chemicals have been linked to a wide range of health effects. These include cancer, elevated cholesterol, effects on the thyroid and liver, and decreased antibody response in response to vaccinations. PFAS aren't new. They've been used in consumer products since the 1950s, but it's only been in the past 5 or 10 years when they really started to get a lot of attention in the public and among scientists. This is due in large part to their widespread discovery in drinking water supplies across the country and around the world. I don't have time today to get too far into chemistry, but I did want to introduce you to 2 of the most commonly found PFAS chemicals. So these are 2 of those 9,000 different PFAS compounds, PFOA and PFOS. These are both what we call long-chain PFAS chemicals, and they're what we call legacy compounds. They're no longer manufactured in the US, but because of their extreme persistence, they're still a part of our environment and still found in most people's bodies. If you haven't already, I would recommend watching the film Dark Waters, starring Mark Ruffalo and Anne Hathaway. It focuses on a community in West Virginia that was affected by PFAS contamination from a DuPont Teflon manufacturing plant, and the heroic efforts of a lawyer, Rob Bilott, to fight for that community. So PFAS is not exactly a household name, and if you look at most product labels, you won't see anywhere on it where it says PFAS, but certain products have trademark names that are familiar to all of us. Think of Teflon, Vortex, Scotchgard, and Stainmaster. PFAS are also present in a lot of products where you don't really have any clues on the product label that they contain PFAS. So things like microwave popcorn bags or certain types of dental floss. There was a great study that came out last year that cataloged over 200 different uses of PFAS, and I'm always learning new places where they're being used. Most recently, I learned about them being in climbing ropes and guitar strings. So we're going to talk a lot today about PFAS in food packaging. So what types of packaging are most likely to contain PFAS? So I have a few examples here. One are microwave popcorn bags. So PFAS are added to these bags to prevent grease from seeping through the bags when the popcorn is being heated. And these pretty consistently have been found to contain PFAS. Silent Spring Institute led a 2017 study that found that PFAS were also commonly detected in fast food wrappers, particularly wrappers for things like burgers or sandwiches that are kind of like have a wax paper kind of consistency. Pizza boxes have also been cited to contain PFAS, although more recent testing that I've seen suggests that they're not all that commonly used in pizza boxes anymore. Where we do tend to see them more often now are actually ironically, in products that are labeled as more eco-friendly. So things like molded fiber containers or compostable straws are great improvements over plastic. Plastic is also, a forever chemical because plastic doesn't break down. But unfortunately, many of these molded fiber kinds of containers have PFAS added to them. So it doesn't mean we should go back to plastic, but preferably we would move towards products that are both, more sustainable and don't contain these types of forever chemicals. Our work at Silent Spring Institute and other studies have found that food packaging, or the presence of PFAS in food packaging, can increase PFAS exposure. So these are some findings from a study that we published in 2019. We found that people who reported eating more microwave popcorn tended to have higher PFAS levels in their blood, and that's not surprising based on what we know about the prevalence of PFAS in microwave popcorn bags. We also found that people who reported eating more meals at home tended to have lower levels of PFAS in their bodies. This could be due to a couple of factors. One could be that the foods that people eat when they're home are different than the foods they tend to eat when they're out. And there can be differences in the accumulation of PFAS in different types of foods. But we think there could also be a connection here to food packaging as well, and thinking that food that's eaten at a restaurant may have more contact with packaging than the types of meals people are eating at home. So in addition to the potential direct exposure among people who use food packaging that contains PFAS, PFAS can also be a source of, food packaging can also be a source of PFAS into the environment. This is related to the locations where PFAS chemicals are manufactured. And also, because of their extreme persistence, they can get out into the environment once we dispose of food packaging items. PFAS can be released from products that end up in landfills, and the leachate from landfills can either end up in groundwater or go to a wastewater treatment plant, and those discharges can go directly out into surface waters. We also know that PFAS can accumulate in sludge from wastewater treatment plants, and that can be applied to land. There was an important study within the past couple of years on defining different types of uses of PFAS, and the paper clearly said that food packaging is considered a non-essential use of PFAS. So it's a use for which there's not an important health and safety function, and there are also alternatives that can be used. So I wanted to share a couple of recent news items that have emerged since our last discussion about this in May. So since then, Connecticut and Vermont are two more states that have adopted bans on PFAS in food packaging. So that brings the total up to 5 states that have enacted bans on PFAS in food packaging, in addition to the city of San Francisco. And a number of other states, including Massachusetts, have proposed bans. And you'll hear more from Senator Moore in a little bit about what's happening here in Massachusetts. If you're curious to know more about state level policies, I recommend you check out the Safer States website. We do a great job of tracking policies that are being considered in different states. And then something that just kind of came across my radar screen last week is emerging concerns about PFAS in plastics. Typically, I've thought of plastics as not necessarily having PFAS. But there was an EPA study earlier this year that found PFAS was used in plastics that were used to store pesticides. And those PFAS were actually leaching out into the pesticides that were being stored in those kinds of containers. Just last week, the FDA issued new guidance about fluorinated polyethylene and how that should be manufactured to make sure that PFAS aren't inadvertently produced for plastics that are used for food packaging. So I haven't seen a lot of information yet to know whether food packaging that's currently used is likely to be plastic and have PFAS in it. So look to this as a sort of emerging topic and concern in the coming weeks and months. So now I wanted to tell you about 3 studies that Silent Spring Institute has underway related to PFAS exposures and health effects. So the first is called PFAS Reach, which stands for Research, Education, and Action for Community Health. One of the main parts of the PFAS Reach study is to evaluate how early life exposures to PFAS, so we're talking about during pregnancy or in infancy, how these exposures from drinking water can affect children's immune systems, and in particular, antibody response to routine vaccinations. Work by our friend and colleague Philippe Grandjean from the Harvard School of Public Health has suggested that children with higher PFAS levels in their blood produce less of an antibody response to things like the diphtheria and tetanus vaccinations. So our study is including preschool-age children in Hyannis, Mass, on Cape Cod, as well as associated with the Pease Trade Port in Portsmouth, New Hampshire. I know we'll hear later from Mark Ells, who's the town manager for the town of Barnstable on the Cape. I wanted to commend the water supply, both in Hyannis and at the Pease Trade Port, for addressing the PFAS contamination issues. The water is now being treated to remove PFAS, but it's still important to do this research because we have opportunities to learn from these past exposures to know more about the types and the levels of PFAS that can affect children's immune function. So if you or someone you know has a preschool age child and lived in Hyannis before 2016, you may be eligible for the study. People who take part are eligible for up to $100 in gift cards. And here's some information on the right side here about how to learn more and reach out to our team. The second study that I wanted to tell you about is called the Massachusetts PFAS and Your Health Study. So this is more broadly investigating how PFAS exposures from drinking water can affect our health. We're looking beyond just effects on the immune system to also consider effects on cholesterol and metabolism, on thyroid, kidney, and liver function, on levels of hormones, and a wide range of self-reported health conditions as well. We will be enrolling adults and children ages 4 to 17 in Hyannis starting in this fall. And our second community is the town of Ayer, west of Boston, and we'll be recruiting in Ayer in 2022. So adults and children will also be eligible for gift cards for taking part in the study. And I should mention for both the PFAS Reach study and for the study, participants will receive information about what we learn about PFAS levels and about the health measures that we measure as part of the studies. For the Massachusetts PFAS in Your Health study, I wanted to note that this is part of a multi-site health study that's being funded and coordinated by the Centers for Disease Control and Prevention. This is including communities in 7 different states that have also experienced PFAS contamination in their drinking water supplies. And here's ways that you can contact our team and learn more about this study. And finally, I wanted to mention the University of Rhode Island STEEP Superfund Research Program. STEEP stands for Sources, Transport, Exposure, and Effects of PFAS. Broadly speaking, the STEEP study is looking at how PFAS move through the environment, how we can detect PFAS, how we can be exposed to PFAS, and how they can affect our health. The Silent Spring Institute is co-leading the community engagement core for STEEP. One of our major initiatives is to study PFAS levels in Cape Cod private wells. If you have a private well in Cape Cod, there's still time to sign up for our study. We'll be collecting samples early this fall, so you still have time to sign up. Our community engagement core has also been developing educational resources with other members of our STEEP team and conducting extensive community engagement. Because of the pandemic, a lot of our in-person activities have been put on hold, but we launched a webinar series this year, and you can hear from our webinar speakers by going to the STEEP website. So just to wrap things up here, if you want to learn more about PFAS, I wanted to point you to several different resources. So the PFAS Exchange is a website intended for PFAS impacted communities and interested individuals who want to learn more about PFAS. It's part of the PFAS Reach study. We have fact sheets, including a couple of examples here, as well as a data interpretation tool for helping people make sense of results of blood and water testing. I'd also recommend you check out the STEEP website, which has summaries of STEEP research, as well as videos and tips cards for minimizing exposures to PFAS. And just to bring this back to food packaging specifically, you might want to know what you can do as individuals or as members of a community. At a household or individual level, you can avoid microwave popcorn and eat more fresh foods as a way to minimize contact with PFAS containing packaging. When you go out to eat, you could ask restaurants if their packaging is PFAS free. They may not know, but maybe your question can spark some interest and have them look deeper into where they're getting their food packaging from. If you're in a position of purchasing packaging for your company or your school district or another institution, you can consider whether PFAS can be part of your procurement process policies. And here's some information here about how you can identify PFAS-free packaging. And then more broadly, you can also learn about how you can support stricter chemical safety testing to make sure that we shift the burden to make sure the chemicals are safe before they go into widespread use. And you're already, by tuning into this webinar, learning more about state and local legislation on PFAS. We'll be hearing next from Senator Moore, who will talk about his work here in Massachusetts on PFAS and food packaging. So with that, I'll put up my contact information and some other resources that I'd recommend you check out to learn more about PFAS. And with that, I want to thank you for tuning in, and I will hand this over to Senator Moore. Thank you.
Thank you, Dr. Schaider. Again, I'm Senator Michael Moore. I want to thank everyone for inviting me to another webinar to discuss the importance of eliminating PFAS from food packaging and how this can also damage the quality of our drinking water. As many of you know, I've introduced legislation that would remove PFAS food from PFAS from food packaging in the Commonwealth. And while getting this legislation is one of my legislative priorities, this bill has not yet been released from committee. The process this year is taking a little longer due to the fact that we are dealing with remote hearings. So hopefully this bill will move forward shortly. Just to go over the legislation, this bill creates policy goals to limit exposure of residents of the Commonwealth to PFAS through food packaging. Under the bill, no person or entity shall manufacture, knowingly sell, or offer for sale, distribution for sale, or distribute for the use in the Commonwealth food packaging to which PFAS substances have been intentionally added in any amount. A certificate of compliance stating that a package or packaging component follows the requirement of this act shall be furnished by its manufacturer or supplier to its purchaser. Their certificate of compliance shall be signed by an authorized official of the manufacturing or supplying company. The purchaser shall retain the certificate of compliance for as long as the package or packaging component is in use. A copy of the certificate of compliance shall be kept on file by the manufacturer or supplier of the package or packaging component. Certificates of compliance or copies thereof shall be furnished to the Department of Public Health upon request and to members of the public in accordance with Section 9. If the manufacturer or supplier of this packaging or packaging component reformulates or creates a new package or packaging component, the manufacturer or supplier shall provide an amend or new certificate of compliance for the reformulated or new packaging or packaging component. So that's the legislation that we currently have sitting in the Public Health Committee. While the bill, again, has not been released from committee, I'm confident that it will be reported out favorably and that I will be doing everything in my power to get it passed. Now, as stated, the bill has yet to move any further in the legislative process, but there is certainly momentum that we can build upon as other states have passed laws banning PFAS, and also here in Massachusetts. There is also a special task force, a PFAS task force, which is studying the issue. So hopefully by the end of this session, we'll be getting or at some point during the session, we'll be getting a broader, more comprehensive report from the task force on other measures that we can enact to try to protect everyone. DEP, the Department of Environmental Protection, has also issued regulations now reducing the amount of PFAS that can be found in our drinking water, which obviously is a step forward. Just as I think Dr. Schaider had talked about, we've had other states that have already moved forward with legislation banning PFAS. One example is the state of Maine that passed a law that bans PFAS from all products, not just food packaging. Other states such as Vermont, Connecticut, Minnesota, New York, and Washington have also passed laws that have banned PFAS in some way, shape, or form. We can build upon this here in Massachusetts by educating my colleagues in the House, in the Senate, and trying to put pressure, or I should say put pressure, or educating them on what actions other states have taken right now. For instance, the whole issue of drinking water and the move to limit the amount of PFAS has really come from advocates inside the scientific community, which is very important because if we're going to be successful here in Massachusetts in getting these regulatory changes and also statutory changes, we need the scientific community to come forward and educate everyone in the legislature on the impacts of PFAS, and I should say the negative impacts on PFAS on society and all of us individually. So I just want to thank Dr. Schaider and Silent Springs for inviting me, and also for continuing to educate us and keeping everyone aware and keeping this issue in the forefront. Again, if not for these types of activities or advocates, this wouldn't be something that we would be able to move forward and it would be a longer process. So I want to thank you all. And again, thank you, Dr. Schaider and everyone else who's part of this, and look forward to hearing the rest of the speakers.
Mr. Ells, could you please put your camera on? Mr. Ells, are you still there?
I am.
Okay, well,
But for some, there I am.
there you are.
For some reason, I just remained blacked out, and I'm not quite sure what occurred there.
Well, I'm looking forward to hearing from you because you are, you work in the town of Barnstable on the Cape, where a lot of this very exciting work is happening. And you've had a major role to play at the local level of really, inviting this information so as to improve your community. So if you would like to jump in, and I believe we've given you, you need the screen. So I'm gonna give you some right there. There you go. And looking forward to hearing your presentation. Thank you.
All right, I'll get right into it here then. And thank you for this opportunity to speak with you all. Certainly, Laurel Schaider has been a partner and a leader in helping us to develop a better understanding of the challenges that emerging contaminants, and specifically PFAS, present to us all nationwide, here in Mass, and certainly right at home here in Barnstable. And Senator Moore, thank you for your efforts. I will certainly watch this as it progresses and continue to educate all that I can relevant to your efforts, legislative efforts, certainly the research efforts, and just a general understanding. And I think you'll see that in what I have to say to you all. If you don't know where we are located, we're on Cape Cod, central to Cape Cod. We're the largest community, one of the largest in the Commonwealth, but certainly on the Cape, and the center for many things here, certainly commerce and recreation, but medical, transportation, education. So it's a busy location, and certainly with that comes the many challenges that any community faces, and certainly Barnstable does. And I'll just give you a little background as to those challenges and how we've moved forward in addressing them. Perhaps no greater feature, though, is maintaining the quality of life and unique character of our community here on Cape Cod, and our coastal waters, fresh waters, drinking waters are key to that. They're central to it. And we all benefit here from managing, protecting, preserving those water resources. So when Barnstable is described as certainly advocating, leading in the understanding, and then the preservation and protection, it's a necessity, quite honestly. Like many communities, we have public and private drinking water wells in our community. And our focus on this issue of emerging contaminants and PFAS really started there. When you take out the north side, which is called the Great Marsh, which is a huge resource area, about half our town sits on top of the water we drink. So you can imagine that everything we do potentially impacts that drinking water. Now, Barnstable is somewhat unique in the sense that it both has municipal water, private water, and district water. So it can get a little bit complicated in that water resource planning in Barnstable. As former public works director and now town manager, I've had the responsibility of managing the public water supply, which we took over in 2005 from a private water purveyor. And we provide water to the greater Hyannis area. And this is where the initial challenge of managing PFAS was identified. And I'll tell you that story quickly. There was a fire training academy, upgradient of drinking water wells. The circles with the black dots are actually the Hyannis water supply. If you look to the left, those are a couple of Barnstable Water District wells. And then as you look into the gray area, those are Yarmouth water supply wells. Well, the red area is a fire training academy where they use fire foam. And the wells immediately to the right, when we began testing for PFAS, were identified to contain PFAS. But as we broadened that sampling, we found it in multiple wells. The airport well, which is a little further to the mid page, and then down on the lower right, those are the Mar wells. We found PFAS, and PFAS now that exceeds the 20 part per trillion standard in those wells. And so this was an issue that was right in the forefront for us. We also have an airport, you can see the runways in this picture, which is immediately south of the Fire Training Academy and upgrading of the Mar well. So another potential point source to be concerned with. We also have a wastewater treatment plant as well in town. So once we identified that we were in exceedance of the 20 part per million standard when established, we moved forward immediately with the permitting, design, construction, and operation of carbon treatment systems on multiple well fields impacted by PFAS. To date, we're into this for about $22 million in capital for the filters and adjustments in the system. It's about a $600,000 annual operating cost. And those are primarily carried by the users, the people who pay the rates for the water in that greater Hyannis area. Even though people come to Hyannis, again, I started out telling you who we are because we serve southeastern Massachusetts. Actually, we serve, we're an international destination, certainly in the summertime. So we serve a far broader area than that. But, in general, we serve southeastern Massachusetts. We've also established relationships with abutting water districts and the town of Yarmouth, and they've both been very good partners in helping us manage this moving forward. We're also looking at additional locations where we might cite future, sources of drinking water. As Dr. Schaider has already talked with us about, these are known as forever chemicals. They don't break down easily. When they get into the system, it's very difficult to remove them. And when you can, it is costly, as I've demonstrated to you. So we all need to be aware of this. We need to know this. But this picture is changing. And I think what Senator Moore has brought forward in legislation is very important, and I'll describe why. PFAS is a challenge in Barnstable, clearly. We live on top of the water we drink. A majority of the properties have septic systems, and these products are used commonly by all of us. They go out through our septic systems and into the environment. So right away, it's not a point source issue. It becomes what they call a non-point source issue, which means it comes from anywhere and everywhere potentially. We know a lot of it comes from us through our septic systems. So managing that becomes a very different issue. So we have a wastewater treatment plant as well, though, in Hyannis that services primarily the commercial and residential properties in Hyannis. It's being expanded, but the focus there is really nutrient removal, and it isn't to remove these emerging contaminants yet. We do need to look at that, and we are looking at it and proceeding with appropriate improvements at that facility. We can choose so what do we do about this? We can choose not to use certain products that contain these chemicals, as is described in this legislation and is discussed by prior speakers, but it's not as easy as it sounds. Modifying an adult's purchasing behavior or behavior in general is very difficult. Plus, the long-term nature of the impacts of these emerging contaminants, is something that everybody doesn't embrace immediately. I spend a lot of time with our youth, and I can tell you that certainly educating our public on this repeatedly is as recent as last night at a civic association meeting. I brought it up, and we had 3 youth in the audience who, they were receiving some scholarships and were just there to participate, which was wonderful. And I always have a call to action for our youth to engage, to understand, to participate. This didn't happen overnight, especially the non-point source contamination. And we're not going to reverse this overnight. And the best way to do it is to try to prevent it from getting into the system. So certainly legislations like that's proposed, or us better educating and making different consumer decisions will be critical to the long-term success of this type of effort. You don't want your community having to do what Barnstable has done, which is pay the capital costs and the operating costs to remove these contaminants once they are in your water resource and potentially public water supply. I can tell you that we have a no detect now in our Hyannis system. So we have addressed this problem successfully. But my point today is that this is not just a point source. You just don't go to the fact that there's a fire training academy or the use of fire foam somewhere, or even in your community, perhaps in an industry that might produce this and therefore have it enter into the environment. This is all of us. We all play a role in this. We potentially introduce it into the environment, and it's our role to understand that and to try to reverse it. I can't say enough about education and preventative programs for our long-term success or engaging our youth. They embrace this immediately, and they turn it around on me every time and say, why are we doing this? Why haven't we stopped this? I don't need to buy Teflon pans. Okay, wonderful. Help us communicate and lead that change. I've also called upon the Commonwealth. I had the opportunity to testify in front of that task force that was referred to earlier by Senator Moore. And I called upon them to lead. Massachusetts should lead the nation in our efforts to prevent the introduction of these emerging contaminants into our environment and our water resources. And I'll just end by saying, we are an example of a community that has lived this and that has moved forward in a positive way to address it. And we stand ready to work with you all on sharing those experiences, what went well and what didn't, and to continue to help Massachusetts lead the way in addressing them. So, I thank you all for these efforts, and I'll remain available for any questions you may have. Thank you.
Tell us a little bit about yourself, your internship, and how this particular issue impacts you and what you want to do about it. And I think it's a great segue based on that very powerful presentation from Mr. Ells.
Well, I'm very happy and grateful to be here today. I'm just going to share my screen with the presentation. Oops. There we go. So my name is Mia Caldwell, and I'm a policy and outreach intern with Massachusetts Breast Cancer Coalition, and I'm a rising sophomore at Harvard College. I'm speaking today as a representative of MBCC and the youth. So I think this is a great segue from what Town Manager Ells was just speaking about to try and get the word out to the public and to the youth, because we are the people that will support the legislators and town officials and scientists that have spoken before me. So the panelists that spoke before me did play a vital role and continue to play a vital role in writing legislation, building a strong scientific foundation, and regulating and controlling the issue of PFAS. My and all my team members at MBCC's role is to help foster support for these three individuals in their respected fields by reaching out to the public through education and advocacy. Today, I will introduce myself, MBCC, and walk through some steps we should all take to support the cause. PFAS is a major issue, but tackling it alone is not possible. We must work in conjunction with one another if we want to stop the issue where it originates, with manufacturing PFAS in products like food packaging, as discussed in Senator Moore's bill, and if we want to confront the contamination already in our water sources and environment, such as with the regulation that Town Manager Ells in Barnstable has dealt with. So I'm a Cape Cod resident, and I have been all of my life. And I will admit that I didn't know how serious PFAS was until I started my work and internship with MBCC. Now I believe that it is vital to pass legislation and support the scientists behind PFAS research. Especially here on the Cape, our sole source aquifer and septic systems, as Town Manager Ells mentioned, puts us at risk for serious water contamination and effect on our environment. This means that when part of the Cape faces PFAS contamination, other communities may be put at risk as well. I'm working with MBCC this summer because I want to support this hardworking organization and the leaders in the field of PFAS, such as Dr. Schaider, Senator Moore, and Barnstable Town Manager Ells. Massachusetts Breast Cancer Coalition is a nonprofit organization dedicated to preventing environmental causes of breast cancer through community education, research advocacy, and changes to public policy. We are different from other breast cancer organizations. We believe that to eradicate breast cancer, we must prevent it first. We are trying to find the causes of breast cancer so that we can stop it before it starts. MBCC is therefore dedicated to confronting PFAS because there's a strong connection between PFAS exposure and a variety of negative health implications. As Dr. Schaider has mentioned and cited throughout her research, PFAS can potentially affect the mammary gland development in the human body, which highlights a connection to breast cancer. MBCC is advocating for PFAS regulation for this very reason, among many others. I started my MBCC internship in May, but I am honored to continue my work with them into the future as a long-term supporter and advocate. MBCC has been dedicated to combating PFAS, more specifically in food packaging, through supporting Senator Moore's legislation and the research done by Silent Spring and Dr. Laurel Schaider. During my time with MBCC, I have focused my work on supporting this legislation and researching PFAS movements and updates. From the start until now, PFAS has made its way into the news on many different occasions. Although there's a lot of media coverage to confront the issue, community members need to be educated. The best way to do this is to share your concern and point individuals in the right direction to news articles, websites, and organizations that can help. I want to take this opportunity and my opportunity today to speak to all of you to explain some easy and vital steps you can take to support the cause. There are two main things that you can do. The first is at the state level, through contacting your state legislators as well as your national legislatures. Here's an example of legislative outreach. MBCC has prepared a message to send legislators in support of Senator Moore's legislation, S1494, an act to ban the use of PFAS in food packaging. It outlines why it is critical and why the legislator should support the bill. You can take this message directly and email your state senators or representatives and ask for their support if they are not already a co-sponsor. You can even draft your own message about this bill or any other PFAS legislation, as there are many important bills that are currently at the state and national levels. You may think that your legislators are too busy or that your opinion won't make a difference in the grand scheme of things, but even though they are in fact very busy, constituents are the priority. I personally used this message and sent it to the majority of Massachusetts state legislators. I received kind responses, and many decided to co-sponsor the bill. These actions help support legislation to hopefully get passed and make the bills become law. Your legislators want to hear from you about matters that are important. Reaching out to legislators is a simple step you can take to support legislation and causes you believe in. Your legislators want to hear from you because it is reassuring to them to know that everyone, especially the leaders of tomorrow, care about what our future will look like. As MBCC Executive Director Cheryl Osimo reminds us regularly, PFAS is an issue that will affect us, our children, grandchildren, and many future generations to come. So people of all ages need to take action. The second step you can take is to work for support on the local level through connections with examples of Barnstable Town Manager Elles. Support your local officials to ensure they are taking the right steps to confront the issue. Barnstable Town Manager Elles serves as a model for success in the field of local municipalities and PFAS control. Look into what your town officials are doing in comparison to confront PFAS. You can contact your town offices to find out more. For example, Barnstable Town Manager Ells and his team have worked to confront PFAS contamination when his water sources were discovered to be over the state limit of 20 parts per trillion. We just heard from Town Manager Ells about how he managed this, but this took the support of many organizations and constituents. You should support efforts that your local officials are taking to confront PFAS. There are also many more resources, both through MBCC, as seen here, and other organizations. Our website provides fact sheets, webinars such as the one today, and downloadable modules that serve to educate the public about PFAS. You can also visit the PFAS Exchange, seen here, which is funded and created by the Silent Spring Institute and Dr. Laurel Schaider. And this will give updated information about PFAS, help you track your PFAS exposure, and provide you with many other resources. There's so much more all of us can do to support our legislators, town officials, and scientists. I encourage students and individuals of all ages to get involved with an organization like MBCC and a cause like PFAS control. Working with this dedicated and close-knit team has given me the opportunity to learn more about PFAS, breast cancer, and advocacy. Their kindness and support has shaped my path. If you would be interested in becoming an intern or a part of our team, please contact myself or Cheryl Osimo through our website, mbcc.org. I'm so thankful for the opportunity to speak with such an amazing groups of panelists. I want to thank each of you, Dr. Schaider, Senator Moore, Barnstable Town Manager Ells, and Dr. Malkas, as well as the whole team at MBCC and everyone listening for taking steps in the right direction to confronting PFAS. I'm grateful for the opportunity MBCC has given me today and this summer. Thank you.
So I'm going to ask that all of our panelists put their screens on, and I do have some questions that have come through. The first question I have is for you, Senator Moore, and if you would please speak to the language, how the language of the bill that has been developed for the state of Massachusetts compares with other approaches from other states, and whether other states are also requiring the same type of certification that you described when you were speaking earlier.
The certification may be a little different in the process of how they implement it, but the concepts are the same. It's banning the source of PFAS. And I think as has been stated by all the other speakers, that if we really want to try to eliminate this, we have to identify the sources, which we know right now is primarily there's a good portion of there's a major source of PFAS contamination and exposure to humans, and I guess even to our wildlife. If you look at what's being thrown out into the environment, discarded, this is a main source of it. And to eliminate it, we really need to ban it, which these other states have actually tried to implement or have implemented.
So, Senator Moore, the other question I have is with regards to items that are shipped in from other states. So if Massachusetts has banned PFAS in food packaging, does that mean that a vendor should not or cannot purchase food wrapping or food packaging for their product that does contain it from another state?
Well, it's all going to depend on how we word the legislation. The intent of the legislation is to stop any packaging coming in that contains PFAS. Now, the final version of the legislation, and this is where we need help from advocates and the scientific community to make sure my colleagues, when we're working on this, if we only limit what's manufactured here in Massachusetts, but don't limit what comes into the state, then obviously we're not limiting, we're allowing a major source of contamination to still come into the state. The goal of this is to eliminate all packaging that contains PFAS.
Thank you so much. Dr. Schaider, could you describe, I know Mia mentioned it with regards to mammary gland development in youth, and that is being the link to breast cancer, but could you describe for us in layman's terms, really the carcinogenic effect of PFAS and how it links to cancer in general and specifically to breast cancer?
Sure, thanks for that question. So, as Mia mentioned, and as I mentioned earlier, there is evidence from animal studies that exposure to PFOA, which is one specific PFAS chemical, can impair mammary gland development. And our work at Silent Spring Institute suggests that chemicals that can impair mammary gland development may increase breast cancer risk. As far as I know, other PFAS chemicals haven't been tested to see if they have that same capacity to impair mammary gland development, but that definitely puts it on our radar screen. There are links to other types of cancers and exposures, mostly to PFOA, specifically testicular and kidney cancer. This is work that came out of the C8 science panel that was conducted in the West Virginia community that I mentioned in the Dark Waters film. There is some additional evidence that PFAS can be linked to cancers, although there's not as much evidence for breast cancer specifically. But taking a precautionary approach, these definitely are on our radar screen as a scientific research organization that focuses on chemicals linked to breast cancer. And I think there's a need for a lot more study. You're on mute, Barbara.
I do that so often. And my second follow-up question to that is, can you again reiterate what are some of the things people can do to reduce their PFAS exposure starting right now, starting today and going forward?
Mm-hmm. Yeah, so one of the challenges with PFAS, especially PFOA, PFOS, the ones that are banned but are still really present in our environment, is that they can stay in our bodies for really long periods of time, on the order of years. So even if you stop being exposed to PFAS right now, it will still take a while for the levels in your body to go down. The newer PFAS chemicals that are being added to products now don't stay in our bodies for quite as long, but can still stay in our bodies for weeks to months. So that's one of the reasons why they're so concerning. It's just that long persistence in our bodies. But in order to reduce our exposures, if you live in a community where the water is contaminated, then the most important thing to do is to identify a PFAS-free drinking water source or to put in some sort of filtration. Fortunately, in my experience, communities like Barnstable and other areas, once they identify contamination in the water supply, do take steps right away to turn off those contaminated sources or install treatment. And with the new standard that's been put in place in Massachusetts, there's a lot more testing going on. So a lot of communities are discovering that they have PFAS and are having to grapple with that challenge, but at least they know. In a lot of other states, they wouldn't even know about that contamination. In terms of other ways to reduce our exposures, as I mentioned, PFAS are in many different types of products. I would say, microwave popcorn is high on my list of things to avoid. Certainly if you're, thinking about any, stain resistant sort of coatings that you might apply to textiles or bringing in any new products like that into your home, definitely skipping those unless you, really need those. And then there's certain types of foods that may be associated with higher PFAS levels, but we really don't have enough information about PFAS levels in food to, at this point, be able to recommend, certain types of foods to avoid. So I think moving forward, doing as much as we can to avoid bringing new products into our home that we know contain PFAS, recognizing that it really shouldn't have to be on individuals to do all that legwork to look for what's in their products, and recognizing the limitations in terms of information on product labels.
And I don't know if this is for you, Dr. Schaider, or for you, Town Manager Ells. The question is, how do I best filter my tap water to eliminate PFAS?
Laurel, do you want to try to answer that?
Yeah, I mean, I'll just cover it at the sort of the household level, and then you can add in any experience at the town level. So, I mean, the first thing to do is to try to find out if there's PFAS in your water in the first place. And the state of Massachusetts does have a website where people can learn about any testing in their water supply. But if you do find out that you have PFAS in your drinking water, that could be from a municipal water supply or from a private well. There are two main types of filters that people typically would implement in their home. So one is an activated carbon filter. These can be pitcher filters with those little chunks of black carbon that people often use, or a solid carbon block filter that you might install into your sink and have a separate little spout that comes out at your sink. Generally, the solid carbon block filters do a better job than the granular activated carbon. It seems like there's some mixed evidence in terms of their ability to really efficiently remove all types of PFAS. In general, the longer chain legacy types of compounds are better removed by activated carbon than the newer replacement chemicals. So it depends a little bit what mix of chemicals there are specifically in your water supply. The other type of water filtration that people think about at the household level is a reverse osmosis system. This does a better job of removing both the newer as well as the older types of PFAS. There are some downsides to the reverse osmosis. So for every gallon of water you filter, you produce several gallons of waste water. And if you're on a septic system, that can kind of mess up the balance of water in your septic system, as well as creating that extra sort of waste of water. And it has some energy costs as well. But it does a better job, I think, across the board of removing PFAS. Because of that volume of kind of wastewater, it's typically used at the point of use rather than something that you might do for all the water entering your home. And Mark, I don't know if you want to say a little bit more about other options that you considered at the municipal level.
Well, certainly on the drinking water well, that's the level that we've implemented. We do it because it's kind of like literally at the end of the pipeline is where we're regulated on this issue. I think that the preventative efforts that we've talked about today are really where we need to focus. If we're going to truly just intend to solve this by putting filters at any or all the locations Laurel or I have described, we really don't get at the heart of this problem at all. So I think it comes back to personal responsibility and us as adults, certainly our youth as they mature into adults, understanding these issues. They become the mental filter here, understanding this and moving to remove them from our consumer buying behaviors, what we purchase. And more broadly, as a municipality, we're looking at putting in our procurement rules, PFAS-free products, so that we also actively participate in that preventative effort. And so the market doesn't always offer that, but we will certainly be taking this under consideration at every level to try to prevent this. So
I'm curious how hard it's been for you as a town to find products that are PFAS free, and are there certain types of products that
it's not even thought about in most cases. And what was encouraging, but also a little bit telling to me at this most recent testimony I gave with 10 other communities, this was the first time, and I've been involved in this issue for a decade and a half actively, and it was the first time I heard other communities not pointing a finger at a point source, meaning a treatment plant or an industrial producer or somebody who put down fire foam, and they were pretty much unanimously saying, this stuff is everywhere, and we got to understand it, and we got to get it out of the environment. And as we see the levels to which we can detect it, become more accurate, and as we see regulation pushing us from 70 to 20, and I think some other states are at 6 parts per trillion, it isn't going to be the larger sources. This is going to be us that are going to be putting this in the environment. So it's very difficult in my mind to rationalize how an adult can turn around and blame it on a public water supply, when in fact the source of the contamination very well may be something that all of us have in our own home. So got to educate. Mia, the call to action's to you. It's good. Didn't happen overnight. So you and your peers got to step up with our help and take control of this.
Thank you so much to all of our panelists today. I every time that we get together, I learn something new. I learn more, and I hope our viewing audience was able to learn a lot as well. And I believe that call to action, Town Manager Ells, is for all of us. So we're all going to make that commitment to reducing PFAS in our environment. Thank you all so much. And thank you to MBCC for hosting this event. MBCC remains committed to preventing environmental caused breast cancer through research, policy advocacy, and education. Thank you and have a good day.